my favorite thing about working in healthcare is the people. This industry brings together brilliant, highly motivated individuals who are driven by the opportunity to make a difference. My name is Hallie Tecco, and this is The Heart of Healthcare, a podcast where I'll be introducing you to the people on the ground moving the needle in public health and medicine.
I was 19 years old when I was first sent to prison. And at the age of 23, I had some regular, I will say, female issues that I was seeking out, the doctor for. And then I was told that I had an abnormal pap smear and that I would need a cone biopsy. And so I agreed to it. And then we discussed cancer. Me and the doctor, we discussed that if they found cancer, would I want a hysterectomy? I was young at the time, very much uneducated, didn't really know the procedures or any other medical options. And I was scared of cancer like most of us are. And I said, okay, yes, if you find cancer, then you could perform the hysterectomy. But when he went in to do the cone biopsy and to also remove what they say possibly was some cysts, he intentionally cut off the blood supply to my ovaries and then began to perform what was a sterilization on me.
That was Kelly Dillon, who was sterilized without her consent in 2001. I was shocked to learn that this is still happening in recent history. In some California women's prisons, hundreds of inmates have been sterilized without proper consent as recently as 2010. Forced sterilization of women who are poor, disabled, have mental health problems, or incarcerated was commonplace in the U.S. just 50 years ago. In fact, the U.S. was the first country to force sterilization for eugenics purposes. While today this practice is illegal, it is still happening. And even more recently, in 2020, a report to Congress by 9 board-certified OBGYNs found that women in a Georgia ICE detention center were subjected, mostly without consent, to unwarranted hysterectomies. Today, I'm talking to Laura Jimenez, Executive Director of California Latinas for Reproductive Justice. Laura has worked with women of color organizations across the country on issues of reproductive justice, including the National Latina Health Organization, the Dominican Women's Development Center, and Sister Song. Laura is passionate about issues of immigration, environmental justice, birthing and parenting as they intersect with reproductive justice. She holds degrees in ethnic studies from both UC San Diego and San Francisco State University. Laura, thank you so much for joining us today on The Heart of Healthcare.
Thank you for the invitation. I'm glad to be with you today.
Let's talk about the origins of sterilization and ultimately eugenics in the U.S.
I think the way we look at it sort of officially is that we look at a certain time period in this country about 100 years plus ago where the eugenics pseudoscience sort of led itself into policy. But I like to think about sort of the way that eugenics has worked in this country as much longer, and we're sort of in this trajectory of when it started, 500 plus years when there's contact, right? Because when we see there's contact, there's genocide, enslavement of people, forced breeding, removal of children. And when I look at eugenics and the policies of sterilization and how it has been used to determine who's fit to reproduce and who is not, I feel like it goes much longer than that. And so in this country, we basically start our history with eugenics policy against specific communities, right, that are encountered. But moving forward, right, to the official policy about 100 and plus years ago, eugenics was then sort of, used to determine, as I said, who was fit to reproduce. And then it crept into state policies. And so we had many states that enacted policies that allowed the states to forcibly sterilize residents of their state. In California, the state sterilized approximately 20,000 people. And for context, the official numbers that I've seen are that there were between 60 and 70,000 people sterilized in the entire country.
Yeah. I mean, it looks different today, but forced sterilization is still happening. I think the most recent example at the ICE detention center in Georgia shows that it's still happening today. So Dr. James Heinrich, who is the OBGYN who performs sterilizations in California women's clinics, was quoted as saying, "This is cheaper than welfare."
Mm-hmm.
First of all, why would a doctor have, I mean, he's enacting policy there.
I think he's actually enacting policy he wasn't even supposed to legally be enacting.
Yeah.
Right.
Yeah. He's making his own policies,
right.
determining what he thinks is best for our society and our government.
And I think, what you see there is just the sort of long-term effects of the ways that politicians sort of put forward their own campaigns and get you stuck on something. So I think there we get a little bit of, Reagan's welfare queen, right?
Mm-hmm.
That phrase and that image and all that it means to people gets utilized in a lot of ways. And so you have people constantly, referring to, well, it's going to cost us this amount of money to do X, Y, or Z. And then you have people who have power, like the doctor that you're referring to, whether it's just, this limited power within prisons, right? Or, maybe they're a senator or congressman or whatever, that start making decisions on their own. Like, oh yeah, we don't want to, we need to cut back on spending. So these people who are incarcerated have, quote unquote, done something wrong. And I have decided, I'm going to make a decision and do something that's going to prevent them from having those children and incurring those expenses.
The bill that you sponsored to help California pay reparations for the survivors of the state's sterilization efforts, that was announced last year, 2021. Can you tell us a little bit more about how many women will receive these reparations?
So the estimates of the survivors remaining are around the 600 number. There's about between 300 and 400 of the legacy survivors, which is what we've been calling the survivors from the 1909 to 1979 period. And then there's about 250 of the prison sterilization survivors. So that's the total of the estimate of who's still alive and could come forward. So our bill was modeled on work that was done in Virginia and North Carolina. They both also created their own compensation funds. They had about 25% of their estimated living survivors come forward. So we're estimating about 25% of that number. So that's about 150, I think. We're estimating a compensation payment of $25,000.
Is that enough?
No amount is enough.
Yeah.
And I think that's something that we've been clearly, saying throughout the time. There's no amount of money that's going to give these people back, give the survivors back what was taken from them, or the violence that was done to them. It is an attempt, and it's a step for the state to be accountable. The state, Governor Gray Davis made a formal apology back when he was governor, but that was sort of it. And an apology is a great first step, but really making amends is different. And so this is a piece of that.
Yeah.
What's another win for us on this piece is that more people know about it. As we have done screenings of the films and talked and shared with people about the reproductive justice framework in this history, as we've been in legislative committees, as we've talked to media, people just didn't know that this happened. Nobody, a lot of people didn't know that this happened. There's a specific set of people maybe that took women's studies or Chicano or Latino studies at some point in their academic career, or stumbled upon one of the films that know that this happened. People, for the most part, just don't know that this happened at this scale. And so the fact that that it is coming to light and people are learning about it is really important. It's not in our educational curriculum, right? No. It's just if you happen to find it some way.
Yeah. When I heard about your work, my jaw dropped. I could not believe that we were still facing this. It was such recent history, but to put the reparations into context, the amount, I was rear-ended by a drunk driver last year, and I don't know what they call it, the compensation that I was given so far from the insurance company was the same amount.
Mm-hmm.
I don't think it's enough. I would imagine that it's hard to put a price on it, but they certainly deserve more.
Yeah.
We'll be right back after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
Tell us about your background. You've worked with a lot of reproductive justice organizations, and what ultimately led you to the work that you currently do at CLRJ?
I feel like I have a funny story. I feel like in some ways I fell into the work that I was doing, but then when I look back at the kind of things that I was doing as a very young person, I don't know that I actually fell into it. I was led to it. I, started out my first job out of college. I was an ethnic studies major at UC San Diego. My first job after that was in the Bay Area with the National Latina Health Organization. And it was just kind of a coincidence. I was thinking of moving there. A friend of mine had been volunteering there and set me up to meet with the director. And in the middle of talking with her, I realized she was interviewing me because her administrative assistant was going to be leaving. And so I kind of ended up with this job there as the admin assistant. And as in many small nonprofit organizations, I started there, and then I started helping out with the youth programming they were doing. And then, I was a trainer, and then I became a program director. And so that's why I say, like, I kind of fell into it. And then but I think there was a path that I was walking on there that I didn't know that I hadn't intentionally landed there. But,
Yeah.
And so after I
knew
was,
it was your purpose.
yeah, I guess so. And so, once I was started there, as part of my work at National Latina Health Organization, that organization became involved with Sister Song, the Women of Color Reproductive Justice Collective, which was a moment in time in the late 90s, really, where a bunch of women of color organizations that had been working on reproductive health and rights were funded by the Ford Foundation to get together and talk about what they had been doing, like what their work had been doing, and what they could do together. And it was kind of it was the first time a foundation had funded a group like in this way, like in an all-in way like this. But it was not the first time that women of color had kind of been trying to get together to do this work together. When I landed at that first job in 1994, I was exposed to people from the Bay Area Black Women's Health Project and the National Black Women's Health Project and the Native American Women's Health and Education Resource Center, and all of these folks and they were constantly in conversation, right? Because what I learned is they had been in movement in their own places, in their own, wherever they were geographically across the country, and experiencing sort of tokenism, constantly being told that women of color weren't supportive of reproductive rights, organizing. And so they started organizing in their own communities and talking to each other about how to best work through this, right? How to best do this work. And so Sister Song was the first not the first, it was like the fifth attempt for women of color to collaborate together. And it's the one that stuck in some ways. So I ended up, after several years, fast forwarding about 10 years, when Sister Song moved from being a project of the Ford Foundation to its own organization, I ended up working at Sister Song as well and helping develop out that organization. And right around the time that the reproductive justice framework was being introduced to the world. So reproductive justice as a term and as a concept was introduced, was created by Black women in 1994. And then I think from that time forward, was really, we were kind of fleshing out, what does this mean? What does this mean, reproductive justice framework? What does the work look like? Who's doing it? How is it being done? And was informed by the theory of intersectionality and Black feminist work. And so it was, for me, that was also very pivotal because I felt like I was this very young person, that had the opportunity, again, kind of fell into, in my mind's eye, I wasn't really ever sitting at their feet, but like sitting at the feet of these women who had been doing the work for many years. Had been in advocacy and movement and organizing for 20 plus years. And I was listening to the lessons that they had learned and watching them create something new and participating in creating something new. And it was important for me, and I think it's an important part of the ways that we do the work, especially when we're at these very small organizations that are led by and for women of color, is that, it's kind of like you jump in as admin assistant and then you get to do a little bit. And there's a lot of like building of your leadership and growing you as a leader. And I'm grateful, that I was sitting with Luz Alvarez Martinez and Luz Rodriguez and Loretta Ross and, Sharon Asatoyer. These are women that are still, doing the work, but they're major, I feel like they're just like, they're my elders, they're my teachers, and they really grew this work. And I feel like more than me, there was just a lot of sacrifice too. There's a lot of sacrifice of themselves personally that, it's their passion and they wanted to do, but, some of it, I feel like it was hurtful and it was painful, but ultimately they created something new and beautiful.
Yeah. Has your perspective and work on reproductive justice changed since becoming a mother?
I became a mother in the middle of all of this. I started my work in 1994 and my first child was born in 2001. So reproductive justice, our tenets are the right to not have children and have access to abortion, contraception, comprehensive sex ed, et cetera, the right to have children without intervention from the state, the right to parent your children. And so I was introduced to people that were doing abortion advocacy, but I was also introduced to people that were doing work with midwives and doulas and trying to make those services more accessible, right, to communities maybe that didn't have the money that it was require to pay for those services. And so for me, when I became pregnant, it was like I felt very empowered to make whatever choices I needed to make about my prenatal care, my birthing experience, about who was going to be present with me, about where I was going to give birth, my being part of the reproductive justice baby movement at that time, like the baby movement that it was at that time, was really instrumental, pivotal in my pregnancy and my parenting and my labor and delivery.
You knew more going into it, but also coming out of it, you were able to bring probably some of those lessons to your work.
I think I knew more from other people's experiences, but I also knew how to, I knew how to advocate for myself, and I knew how to bring other people. I knew how to ask for help, right? And not be isolated or alone in the experience. And I think, what we see a lot of times is, with pregnant and birthing people, that there are so many opportunities to be isolated and feel alone and not know what you're doing and not know what the right questions are to ask, or not trust yourself and just allow a medical provider to sort of lead you down, a road of decisions that maybe you're not comfortable with, right?
Mm-hmm.
Without knowing that you can ask those questions. And my experience with medical providers is the more questions you ask, the more they step back from kind of pushing you in particular ways.
Yeah. It changes the dynamic. They know that you're informed and that you'll be an advocate. And I find that I was having this conversation recently on another episode. Why are we so afraid to get a second opinion? We feel like there's this loyalty to the one physician that you're seeing at that time, and it would somehow be insulting to them if you want to seek another opinion or talk to another doctor.
Yes, I'm actually currently being treated for breast cancer and was diagnosed last year. And I actually, when I went to the first oncologist that I was referred to through my insurance at that time, I did not have a good experience. And she came in the room, she was with me for like 15, maybe 20 minutes and had like outlined my care plan and was just like, gone. Right. And it didn't sit right with me and I couldn't figure out why. And, we were in COVID already. So I had brought a friend with me, but she didn't come in, but she had actually sent me in with the phone recording and she listened to the recording like 5 times and was like, no, no, no. And so, I've worked in healthcare advocacy all this time. And so, we immediately started looking for another doctor, went to another doctor. And, first the consultation was like an hour and a half. It was just an unlimited amount of like, there was time given, there was attention to my questions. There was not just kind of like a desire to push me towards her treatment plan. And I, in looking at it after the second consultation, I was like, I had such a deep sadness for people that, I had seen in that first office, and there really was a difference. Yes, doctors have a lot of education and it's important, that we're listening to them, but it's part of decisions we have to make, right? Yeah. We have to take their expertise and decide what's best for us, for our body, our families, and how we want to move forward.
Yeah, absolutely. What work are you most proud of?
Right now, I'm very proud of the work that we've done on the Sterilization Compensation Fund. Yeah. I think we spent many years working on this in one shape or another. And having met some survivors of sterilization and hearing their stories and knowing that the work that we're going to do is going to affect some of them feels really amazing and huge to me. And again, like it does not change what was done to them, right? It doesn't change the violence that was enacted upon them and their bodies. But it does feel like a huge step.
Yeah.
What work I'm most proud of also is I have 2 daughters that I think are amazing. They're 17 and almost 21. And they have grown up in the reproductive justice movement from like I was literally, I think, the first person to birth a baby during the Sister Song times. So they've been, nursing at conferences and running around at conferences and, to helping at conferences. And so they're very clear and assured that their body is theirs. They have no questions about their bodily autonomy. Yeah. And, I listen to them talking to friends, and I've watched from, the time of first grade when one of my kids was deciding to tell friends about sex, which maybe have been unwelcome by other parents, but she gave them lots of information to like high school when I hear them, saying, everybody comes to me to ask me questions about sex and reproductive health because they know that I know. And so it's like just amazing to me to be like, yeah, this is so cool that like this life's work of, almost 21 years now is like, I see it, the fact that they've been with me and, they've been around all these folks and seen the movies and listened to the analysis. They're right there, whether or not this is something they choose to do in their lives. It's in them.
Yeah. So, do they want to? Do they want to carry on the work in this space?
I'm not certain. If they go back and forth, they definitely have been involved in things sort of informally, but they're both sort of trying to figure out what they want to do with their lives right now. And so I don't know.
Yeah. So what's next for you in the organization, and how can people support your work?
We are working on the implementation of the Sterilization Compensation Fund. But I think what we're also working on that's really important is we're working on some collaborative work with other partners here in California around the declaration of racism as a public health crisis here in the state of California.
Amazing.
And sort of looking at what are the concrete steps that can be taken, like impactful steps that are beyond just saying, racism is a public health crisis in California. What does that mean? And so I think we're at this moment where, especially like in 2020, COVID, the George Floyd murder, and the sort of, the constant racial reckoning that in the society now, they collided in a way where it was like, people were like, systems are breaking down, COVID, no, systems were not breaking down. Systems were working exactly as they were designed to. And that means that the poor, folks of color, immigrants, people with disabilities, those were the folks that, were most marginalized, were not getting, the access to resources. And dying, right? So I think that as we look at this, we have the opportunity, because these things sort of collided in this moment, we were able to say, okay, this is a systemic problem. This is not just, we need to fix the ability to do telehealth appointments, right? We need to talk about the systems that are in place and how do we fix those. And so I think that that's a huge piece that we're working on. And I think, and the other piece that's really, major right now, of course, is waiting on the Supreme Court. Waiting on the Supreme Court to see
edge of our seats
how badly they mess with Roe v. Wade and what is about to happen. So, we're also in California, we're part of the Future of Abortion Council, which is a group of 40 organizations that have been meeting to talk about what is the future of abortion, given that we may have people from, 20 plus states that are seeking abortion care here in California. What do we need to do? And so we're really looking at, where do funds need to be allocated? Do we have enough providers? They're estimating a 3,000% increase in the number of people who will come into California seeking abortion. So, clearly we're going to need more providers, more funds, more protections, just to make sure that, people can't be charged here in California because of Texas's law and all of those things. So we're really active in that piece right now as well.
Disaster preparedness.
Yeah. And I think what's important to know is, I don't think that we are by any means ready, but I would say that California, we're not a perfect state. There's definitely lots of work to do here in California around access especially for marginalized communities. But the fact that we are in a state where we are able to pass proactive legislation on reproductive rights is not just because we have a Democratic supermajority. It's because there's 30, 40, 50, almost 50 years or more of activism and advocacy that has been done in the state to make the conditions so that the people of the state recognize that bodily autonomy and these, rights to abortion and contraception, comprehensive sexuality are important. And we've, collectively pushed legislators and governors to make sure that this happens. And so while we're not ready for this influx of people, I think we are ready in the sense that I have been able to identify what we need. And hopefully we'll have the support of the state, the government, to be able to make it happen as quickly as possible.
Wow. Well, we have made a donation on behalf of the podcast to your organization. And
wonderful. Thank you.
Thank you for the amazing work you do. Thank you so much for being here. If you're listening and you want to follow Laura's work, you can visit their website, californialatinas.org. Thank you for tuning in to the Heart of Healthcare podcast.
Thanks for listening to this episode of the Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of OffScrip Health. We are a healthcare engagement company built for patients and caregivers, by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our senior producer is Brianna Seeley. Our intern is Antonella Sterniolo. Our host is Hallie Tecco. It is recorded, mixed, and edited by Brianna Seeley. For advertising and media inquiries, email media@offscrip.com. That's media@offscrip.com. For more information, visit offscrip.com.